I want to thank you for coming into Hillside Chiropractic for your first visit. Many patients notice 4 things following that visit. 1 is I treat differently. Number 2 is that I'm more focused on the cause of the problem instead of chasing the symptoms. 3rd is that your range of motion is improved. And 4th is that you're tender. I'm going to step back and take a minute and go over each one of those. First, I said is I treat different. I use ART, or active release technique, which is a proven process of breaking up scar tissue and getting the soft tissues of the body to move properly again. I do that, as I said, by breaking up scar tissue, which in turn is going to help improve your range of motion, ultimately reduce your pain, restore proper nerve function, and re-educate the muscles. Re-educating the muscles is a very big part of this, and that is because of muscle memory. Muscle memory occurs after an overuse or repetitive injury type of problem where the body tightens up everything around there to compensate for that dysfunction that's occurred. It doesn't want to keep on having everything move properly because that's going to cause more injury and cause more problems and increase your pain. So that dysfunction is kind of housed in there and where it doesn't allow anything to move. I have to break that cycle. Number 2 is that I'm more focused on the cause instead of chasing the symptoms. That is because I'm going to the root cause of the problem, which is that scar tissue, which is that deep knot in the arm or in the back or something like that that is causing that problem. The 3rd, by breaking up that, is I get the range of motion improvement. The range of motion improvement is going to be a little bit right away, and you might notice that it kind of snaps back and doesn't quite stay as loose as you felt afterwards. That's because of the muscle memory. Each time I do this, the muscle memory is going to let go a little bit and a little bit more. The 4th one is that you're tender. You're probably tender because I broke up that scar tissue. It's tissue we don't want, but it's still tissue, so it is going to be a little tender, feel a little bruised. The best thing you can do for that is to put some ice on it. 20 minutes on, 20 minutes off is the best way. Drink extra fluids, make sure you flush out that area, and kind of rest because you are more susceptible to injury. As that muscle memory is getting broken up, some of these muscles are going to start doing some activities that they haven't done in a long time. They haven't stretched in a long time, so they're going to be weak. And if you start doing stuff you shouldn't be doing, they're actually going to feel worse and probably injure even more than you are now. The reason I want you to come back soon is because we have to build upon that first visit. I have to continue to try to break up that scar tissue. Each time I do this, I'm going to break up a little bit more, and go deeper and deeper into those levels that are really causing the problem. And each time I do it, we're going to be re-educating the muscles more, breaking up that muscle memory, which might have been present for a long time, so we have to do some work to get that back to where it was. I want you to come in with questions for your next visit. The most common question is, how did I get this way? Well, how did you get that way is because of some of those repetitive injuries. Might have been what job you did, back when, or an old car accident is a very, very common one where people think they weren't hurt at the time because your body compensated for it. That dysfunction's been there, your body's just compensated for that with a muscle memory, and now it can't take it anymore because it's kind of like the straw that broke the camel's back. Is what I use the most, is that you did something recently that caused the problem and now you're having pain and we have to go back and take care of that problem that happened years ago. Your next treatment will be easier and results will be longer because it's going to be, your body's going to start getting used to it and it's going to handle that and start compensating for what I'm doing. This is a proven process. The body will respond and improve with each visit as you come back.